I want to call on Deputy Josepha Madigan. Are you
yes.
ready and prepared? Thank you very much, Deputy Madigan. You're listed to share time with Deputy Michael Darcy, but
I'll go ahead.
Go ahead. Thank you.
Thank you. Gurmagat, I'm delighted to speak today on mental health, and I wanted to speak on the last occasion, but unfortunately I had a foot injury. But I know that it is a great concern to all of us, and our society has become more complex and our purpose less clear, and the route our lives will take less certain, and the strain of the multitude of tasks that we have to perform on a daily basis and the ever-increasing fast pace of the world can place great stress on all of us. And depression and mental illness can transform the beauty of a bright, beautiful May day like today and a world with promise into a place of dread and worthlessness. And those days when life has to be endured and where it all seems like a pointless crawl towards old age is a burden that many with depression and mental illness face on a daily basis. And even of those of us with good mental health know painful times, days where life seems without meaning and pain and disappointment are very present. And these times, however, give us an opportunity to show empathy with those who suffer with bad mental health. And understandably, there has been a lot of focus on the budget in recent times in relation to the mental health budget. And since 2012, we have provided continued spending in this particular area. We have to remember that our national debt, which increased from 47,000 million in 2007 to 189,000 million in 2011, the year that Fianna Fáil and the Green Party left, is a reality, and that mental health funding strategists will have to grapple with for decades. And I want to be part of a government that will be able to better resource mental health in the years ahead. We are doing this incrementally. The gross non-capital mental health budget has increased from 700 million in 2012 to 791 million in 2016. And while we have a lot of work to do in the field of mental health, and always will, we should also take stock of the improvements we have made in this vital area. The era, Ceann Comhairle, of large, fully operational, industrial-sized psychiatric hospitals in places like Ballinasloe and Portrane are gone. If we remember 1963, the year President Kennedy visited Ireland, there were over 19,000 people in psychiatric institutions, 0.7% of the national population, where more than half with a diagnosis of schizophrenia. The transition of St Brendan Psychiatric Hospital in Grange-Gorman from a dreary, hidden complex with a peak of over 2,000 patients is now into a vibrant, new Dublin Institute of Technology, reflects our commitment to change. There was a time not so long ago where depression and mental illness were shameful, hidden, taboo subjects, but no longer. And even though our society has become more complex, it has also become less judgmental of people, and quite rightly. The Mental Health Act of 2001, passed by this House, puts the rights of users of psychiatric hospitals on a statutory footing, clearly setting out the rights to a decent standard of care in their best interests and with the view to review involuntary detention. And we have now moved into a new era of mental health. And with this Act, psychiatric patients are better protected with a robust Charter of Rights. As a people, we have to reach out to our brothers and sisters in their despair, acknowledging their pain and showing solidarity. As a mediator and as a family lawyer, I have seen how depression can engulf a family, particularly in one-parent families with mental health concerns, and children, of course, are particularly vulnerable in these circumstances. The funding for the child and adolescent mental health services is, of course, a priority. I am happy to see that there have been improvements in this area, so vital for young people who are affected by mental illness. Those waiting for in excess of 12 months for treatment from December 2014 to April 2015 have reduced by 60% under the CAMHS waiting list initiative, and an additional 8 CAMHS beds were added with the opening of Lindara in December 2015, which increases the CAMHS beds to 66. These are modest achievements, but made at a time of unparalleled economic adjustment. And this is an acute area and an area where improvements will be made. And the urgency to do so must be informed by our suicide rate among 15 to 19-year-olds in Ireland, which is frighteningly the 4th highest of 31 European countries surveyed. We really have to take this into account. The new programme for government does set out an ambitious strategy on mental health, and the government is committed to meeting the recommendations which are set out in a vision for change. This strategy, as we know, sets out wide-ranging recommendations: improved communications for continuity of care, referral protocols, direct access to diagnostic facilities, discharge plans, integrated care pathways and shared care arrangements. And since early 2015, we also have clinical nurse specialists in psychiatry who have started work in emergency departments to provide a rapid response to those who present with self-harm. I'm not sure if Deputy Darcy is in the chamber. He is. Okay. Sorry, I'll finish now. Just suffice to say that those who speak out in relation to mental health need to be commended. They show how illness cuts across all sections of society, and I will certainly can reassure this House that I will do all I can to ensure continued investment in the mental health of all. Gurmil Malgat Ken Cora.